All right, May is National Stroke Awareness Month, and we're looking at what happens after someone has had a stroke. We're joined by Dr. Kelly Matbati, Director of the Stroke Program at Rochester General Hospital, along with Dr. Jay Morrow, Medical Director of the Neurointerventional Program, Surgery Program. We thank you both for joining us today. So let's get started. So when you have a stroke and you are taken to the hospital, what happens first?
So we encourage people to call 911 if they're having a stroke so that they can be brought in by an ambulance. And if you're brought in by an ambulance, the ambulance crew can call ahead to the hospital to let them know that you're coming and get everything ready so that when you arrive, they can get you right in, pull you to the front of the line, and assess you right away.
Right.
Because we know time is brain. We want to assess people and treat people as quickly as possible.
Yeah. And that's so important, too, because the damage can be done quickly, right?
Right, right. So about 2 million neurons die a minute when you're having a stroke. So we want to get people in and, you know, do a quick exam, roll them right over to the CAT scanner so we can get a quick picture of their head, see if there's any bleeding in the brain, and to see what kind of treatment they might be eligible for.
Now, there's when patients are examined, you can tell what kind of stroke, right? Because there's a couple different kinds of strokes, right, that a person could have.
Right. So there's ischemic stroke, which is caused by a blood clot, and there's hemorrhagic stroke, which is caused by bleeding into the brain. And we can see on the CAT scan which type of stroke might be causing that, and then see what kind of treatment you can have.
Yeah, TPA is something that we've heard about, right? It's a it's a very special drug that does a lot of hard work, doesn't it?
Right, so TPA is a clot-busting medication that we can give within 4.5 hours of the last time that you were seen well. And it tries to bust up that clot that is causing the stroke. Sometimes TPA isn't enough to treat a stroke, and that's when I call my colleague, Dr. Morrow, for his expertise.
And I want to, Dr. Morrow, you've got something that's fascinating to show everybody. What is this?
So this is actually a stent retriever. So things will be moving pretty quickly when you get to the hospital for us. So as you're getting prepared, I'll just ask you to hold up the end of that catheter. Just point that kind of straight up there.
Okay.
And if you push that out.
Oh my goodness.
That is actually what we use to grip the clot and pull it out there. And if you have a feel of it, it's actually very soft.
So this is what goes in and just yanks that out.
Yep.
The clot.
Yep.
And when you do that, what does it do to the brain or to the...
So immediately after deploying one of these stent retrievers, that a lot of the time restores some flow. So it gives us a little bit of the brain a chance to breathe.
This is
let that sit for a few minutes, incorporates the clot, and then after that we then pull the stent retriever out as a unit, open.
Wow.
And hopefully that pulls the clot out with it.
So you use this as one of your tools, and it's called thrombectomy?
That mechanical thrombectomy is the term. There are a variety of tools. The stent retriever is one of them.
Right.
The other way we do it is a aspiration, so kind of a vacuum type device that basically grips the clot, and we pull it out in that manner as well.
That's incredible. Wow, the way you're able to do this, I mean, then there's progress being made in the way that they improve treatment, right, all the time.
And we see some very dramatic improvements with this type of treatment. You know, people may come in and they may be paralyzed on one side, they may not be able to speak, and then after receiving this treatment, they can make a remarkable recovery if we can get to them in time. Yeah,
again, call 911 right away. That's the key, right, if you suspect someone is having a stroke. Wonderful. Thank you so much for showing us. I've never seen that in action.
And
that is fascinating.
I'd encourage people to have that conversation now with their family members, because we'll be consenting quickly, moving quickly. And if you've had that discussion ahead of time with your family about what they would want done, it'll help the process go a lot faster.
Is that with a healthcare proxy or...
Healthcare proxy, family members, just so your family knows what your wishes would be if you got in that unfortunate situation.
Yes, that's a wonderful piece of advice. Thank you both so very much. We appreciate your time. All right, coming up, we're talking about the Tour de Cure in this week's Health in a Handbasket. Emil Mokhyber from Emil's Subs is a